my little assistant for taking attendance if I need help. So takbir for Sister Leah. Please, I don't like to do this. Remind us that if we're reading the Quran, we want everybody to be. Pin this on your radio. Sisters and brothers, I don't want any noise in the hall. If you have your children running about, please take good care of them.
أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. إنا أرسلنا نوحا إلى قومه أن أنذر قومك من قبل أن يأتيهم عذاب أليم قال يا قوم إني لكم نذير مبين أن اعبدوا الله واتقوه وأطيعون يغفر لكم من ذنوبكم ويؤخركم إلى أجل مسمى إن أجل الله إذا جاء لا يؤخر لو كنتم تعلمون قال ربي إني دعوت قومي ليلا ونهارا فلم يزدهم دعائي إلا فرارا وإني كلما دعوتهم لتغفر لهم جعلوا أصابعهم في آذانهم واستغشوا ثيابهم وأصروا واستكبروا استكبارا ثم إني دعوتهم جهارا ثم إني أعلنت لهم وأسررت لهم إسرارا فقلت استغفروا ربكم إنه كان غفارا صدق الله العظيم.
So I'm very happy, alhamdulillah, that we have the opportunity to have an event like this today. Inshallah, as you've probably seen in the poster, that it's going to be a discussion about mental health. And it's a very pressing topic, especially, after COVID, after a lot of people went through, much less socialization than normal. It's become an even more pressing topic than normal. And so I think it's important to address this kind of topic with trained professionals. So alhamdulillah, Dr. Osama comes from the Sharon community. He is an MD, he's a psychiatrist. And so inshallah today we're hoping to have a very interactive session. So your participation is going to make this very helpful, inshallah. And I can tell you personally, I've benefited a lot from Dr. Osama's advice. And inshallah, it'll be a good experience for all of us.
You can speak in that one. Just click this one for and anywhere.
Assalamu alaikum warahmatullah. Alhamdulillahi rabbil alamin wassalatu wassalamu ala rasulil kareem. So Jazakallah Muhammad for inviting. So my name is Usama Feroz. I'm a trained psychiatrist. I graduated from Harvard University in 2015, then went to George Washington University, did my fellowship there, and for the last 7 years I've been working in Rhode Island. Now I have my private practice in Sharon, Foxborough area. So when would it go there? Okay. So when Muhammad asked about this, so generally I don't like to give lectures because I think the problem with lectures happen that after 10 minutes, whatever you are saying, 5%, 10% it starts leaving you. And by the time you're done, only hardly few things stay there. And I requested him that it would be much more beneficial that I don't know the community, so I don't know how this community generally take these issues or like to discuss these issues. I have these sessions or these discussions multiple times in Sharon and Quincy Masjid and all those communities, so I know how to deal with that community. We can think of this session today as a primer, and if you guys would be interested, maybe in future we can always follow up if we need to. So let me pose a question to you. So you open it up and then we can have a discussion about it. What is your personal understanding about mental health, its significance, or how much have you guys heard about the terms anxiety, depression, and all that stuff? Whosoever would like to start, we can start the discussion. Sure.
That's where I guess the people who are in well health, they are like anti-corruption like that was they mentally are because they believe in Allah and they are happy and content. And one of the things that can also relate is that some say when not right mentally when I happy with all the things, no matter what kind of condition you have, you don't worry about
So Jazakumullah khair, just to summarize what he said, that from his paradigm or the way he would look at the issue of mental health, that is the physical health plus spiritual health, and the more stronger and good spiritual health you're going to have, it has its own benefit. And he quoted from the Quran about Nafsul Ammara, Nafsul Mutmainna, and how that's beneficial. But now let's forward the discussion from here. Then what you are saying, should I assume from that if someone is a really practicing Muslim, he cannot struggle with either anxiety or depression? Right? So basically is it a possibility that someone can be a really good practicing Muslim who is offering 5 daily salah, he reads his juz of Quran, but can struggle with anxiety and depression? Possibilities there? Okay, that's good. It's a really good thing that you nodded yes. Because one of the biggest problems which we have in our community, we have conflated all these things together. And somehow we have an understanding that someone who is a practicing Muslim cannot struggle with these kind of issues. Or the most common thing which happens if someone comes to us within our community and says, oh brother or sister, I'm really struggling with like depressive state or an anxious state. What is our knee-jerk reaction, knee-jerk advice to those people? What do we generally do within our families, within our friends and all that stuff? Go ahead. You can stand up, and because kids are loud, so you can stand up and say it. Right. Start praying, which is good, but it is only an advice of a lay person without knowing or understanding the reality of the problem. Are we talking about clinical anxiety, clinical depression, or are we talking about someone had a bad day at work or school or something and is going through some short-term period of an issue? Because when we, as trained professionals, look at these issues, we look at these issues not as something that someone woke up one day, had an argument with the wife or husband, or had a bad day at school, and that evening that person was feeling down. That's not depression. Now let's understand what a depression would be from a clinical perspective. Depression, I know there's a layman understanding how this word is used, but there's a clinical aspect to the story. And the clinical aspect to the story is if someone, let's say someone like me, who is just finishing his youth, entering his middle age, works as a professional, and says to a doctor, the doctor, I have been struggling for the last few months. Every single day is a burden for me. I feel like I have to push myself to go through the day. I wake up because I have a wife and kids and I have to take care of them and I have a job to go, but I don't want to get out of bed. I have to push myself out of it. My motivation is down, my energy is down, my mood consistently, remember the word, consistently stays low and depressed for most part of the day, every day. To the point, now I'm going to take you to different levels. I just started with the basic level, and if it stays untreated, then the next stage thing comes. The doctor, sometimes now I think my life is so burdensome that I would prefer to die. Because life is miserable. But I cannot tell my wife about this because she's going to get scared. I have 2 kids. I cannot tell my mother because she's also going to get scared. But this is how I feel. And this is not something I'm feeling for the last 2-3 days. It's been going on for a few weeks to months. And I don't know the reason. I have a job, I have a wife, I have kids. There's nothing wrong in my life, apparently. I'm a religiously practicing Muslim. I am sincere to my faith, but something is not right. Did you understand? And do you understand the picture? This is what clinical depression is. The state of mood which makes your functionality poor, that you struggle with your day-to-day life. You take this to another level. And the psychiatrist asked, okay, Dr. Feroz, did you ever think of killing yourself? And then I put my head down and say, to be honest, for the last 1 week, when I go to bed at night, I've been having these kind of thoughts. That should I jump out of the window? And I just ignore those because I'm a religious Muslim. I know it's a sin. I'm not going to do it. And when I got that thought, I got scared and I thought I need help. And this is a typical story how it goes. People never come to a psychiatrist's office right away, especially within our community, because that's not the culture. Within the typical American culture, it's a little bit more open now. People just seek help. But even then, within them, there's a lot of resistance. Why do you think there is a resistance about this? Use your common sense and give me an answer. Why do you think seeking help for mental health issues has a resistance? Good, excellent. Same answer? Someone else? It makes you bad Muslim. There's a lot of stigma. I fell down, I broke my leg, everyone can see that. And I can come to the masjid putting a plaster on it, and everyone would be coming to me and saying, what happened? I'm so sorry for you, and I have a story to tell. I had a car accident, I broke my leg. Now everyone can see that, and then people have sympathy for that. But it's difficult to explain what you cannot see. And if you don't understand what you cannot see, then people have their own interpretation. As he said, his friend would come to him without knowing his clinical situation. The reflex is going to be, when was the last time you prayed? When was the last time you read Quran? When was the last time you did this? Did you do this zikr? Did you do that? And then on the top of that clinical struggle, we make it a spiritual struggle for that person. And we create the guilt of the bad Muslim issue. I'm just talking about specifically to our community because I'm talking to my community. I'm not, because we all have the same frame of reference. We think all of the illnesses come in this dunya from whom? Say, who from whom? Why you guys can be confident to say this? All the ibtila come from whom? Right? And who sends the cure? So our paradigm is same. That's why we can talk about it, how we need to understand this paradigm while staying within our reality. I was just telling Muhammad, I just saw a Muslim patient guy from California this morning, someone in their early 30s, severe anxiety, severe depression, struggling, literally struggling. But when you're sitting as a professional, you have to be very professional. You don't bring religious stuff into it. You act as a professional. And I listened to him for 35 minutes. And he started coming up with these same things, it's my faith, I'm not going to take medication and all this. I listened to him for 35 minutes. And after 35 minutes, I asked him a simple question. So like, you just tell me, have you been a functional Muslim while being in this state? And he said, no. So I asked him, do you prefer to be in this state without treatment, that you are misery for your own self and not of any benefit to anyone? Or would you prefer a state in which you seek treatment, get better, and be a functional person? Choice is yours. Now, secondly, we somehow have also misunderstandings because many of us have come from immigrant backgrounds, and how these issues and subjects are dealt with in our home countries. They're pretty, I don't want to use any harsh word here. They're a pretty bad way of dealing with these issues. We actually misuse and abuse Quran, right? Someone coming and the person comes and they throw Quran at him for everything without understanding the nature of the problem. From my perspective, it's a misuse and abuse. Because our understanding of the Quran has become very different in a way. While Allah and His Sunnah, Prophet's Sunnah is very clear about that shifa in this dunya is through means, right, Muhammad? I, as a practicing psychiatrist for the last 10 years, have been treating patients. Not even once I ever thought that my medication is going to cure anyone. I always had the belief that shifa comes from whom? Allah. But in this life, we have to use means. For example, this is means to make my voice louder so that more people can hear about it. Now, that's one aspect of the story. Similarly, people become anxious. And that's more of a problem with females. Your mother would be anxious, but she would be hiding. But how does she show anxious behavior? How do your anxious mother shows her behavior? She would be edgy. She would be on the go. Whenever she would speak, she would end up telling you the worst thing which is going to happen, even if nothing has happened. For example, if the kid is running, then suddenly the anxious mother would say, don't run, you're going to fall. If you're going to fall, this is going to happen, this is going to happen, then your father is going to do this, then who is going to give the money? And the anxious brain keeps going on and on. Then those people don't sleep well, they don't eat well, they stay on the edge. And whether men or women, they struggle. 20% of Americans struggle with anxiety on a daily basis. What does it mean, 20%? Every fifth person. Now, does that happen in our household? It does. But what do? We push it under the carpet. We ignore. The person struggling cannot explain, and the person who is listening cannot understand. Because there is communication gap because of lack of understanding. Then she keeps suffering throughout the life, while being a mother, while being a wife, while being in the center of the household. She's never able to explain that I cannot sleep well at night. She cannot explain I have a pit in my stomach which just keeps me anxious all the time. I'm not able to relax. So I'm just talking about these day-to-day things. And now, interestingly, lately, I've been seeing more and more Muslim patients. I think Muslim patient is actually the wrong term. I'm seeing patients who happen to belong to our community. There's no Christian patient or Muslim patient. Patient is a patient. Anxiety does not have religion. If your nervous system snaps, the risk of snapping it for me, for you, for any other human being is same. Now, where does the role of family, religion, and other protective factors come? It's huge. But those are protective factors. They are not absolute protective factors. You understand the difference? Like, for example, if even within the clinical secular psychiatry, we have this, okay, the one who is a married male has more protection emotionally than a single divorced male. Someone who is young with strong faith has more protection than someone who does not have any strong belief system in which they can protect themselves. These are factors, but they're not absolute factors. Now let's go into domain of a little bit of the kids. You might have heard the term of ADHD, right? A common term which is attention deficit issue which children or people struggle with. It's a completely neurological problem which the kid is struggling with, but the way they are showing their behavior, they cannot concentrate. They struggle in schoolwork, they cannot finish their assignments. While they are not able to do what they want to do, how do mostly parents react to this? Without understanding the complete picture, we become reactive, right? We say, you're lazy, you don't want to work, you don't want to study, why don't you listen to me? You are a problem for me. And then we create emotional trauma for the kid, while that kid is not able to understand, I don't know why I'm not able to do what I am given as a homework or assignments. So I'm just giving you snippets of how it works out there. 11 years, actually 13 years ago, my perspective about all this was exactly the same the way your perspective was. I come from Pakistan, very typical Pakistani family. very typical understanding of, even in my, when I graduated from med school, there was no psychiatry out there, only 3 weeks. That was the last subject which anyone would like to go to or think about and all that stuff. I come here like a typical immigrant graduate, wanted to go to medicine, but Allah has His own plans. I ended up into this field. Initial 2 years in my training, I would question everything which my teachers had to say. And I would come from the religious paradigm because I was stuck with that. I always used to believe that, okay, oh, I would never say it to anyone, but I would always be like, probably because they don't have a strong foundation, no family support and all that stuff. Probably that's why they are struggling. But as I started seeing more and more human beings in the last 12 years, I realized illness is illness. The way cancer is, the way diabetes is, the way hypertension is, the way celiac disease is, the way loss of hearing is, weakness of eyes is. With the same eyes, but right now everything is blurred now, literally blurred. I got it later in my life at the age of 30. And the day I got it, then I realized that the blessing can be there, but the functionality of blessing is not in your control. And if you end up getting an issue in the functionality of the blessing, you should be thankful if you are able to find a solution for that. I literally thanked Allah that I only had to put glasses to see clearly. So same way mental health is. We are living in the age of mental health crisis. It's only going to get worse. I don't want to create a dark, gory picture out there. Most of you, like me, who have passed a certain point in life, we have passed through that. But these beautiful kids, may Allah protect them, but the way society is, the way things are heading, since pandemic, stats are only worsening. The rate of depression is going up, anxiety is going up, more and more teenagers are visiting ERs for suicidal thoughts and suicide attempts, more and more struggles. I know that typically our reactive mind is, oh, it's because of social media, it's because of Instagram, it's because of TikToks, it's because of this, it's because of that, it's because of this. And these are assumptions, correlations, but none of this is causation. You understand the difference between the two? Fair enough, I can understand. For example, I saw a 15-year-old few days ago, maybe girls can understand. She was struggling with the issue of body image, right? How it goes. Why? Because she was so busy with watching images on Instagram and comparing her body with their body that she was getting more and more problems with her depression, anxiety, and all that stuff. We cannot stop this onslaught. If Muslim community has this assumption that we can live in a cocoon and our own ghettos where nothing is going to affect, sorry, it's not happening. It's just not happening. Our kids are almost as much as risk of these issues as any other American family out there. Yes, if your family is really good, strong parents, good education learning, these are good protective factors, but they're again not absolute factors. So this is just a brief synopsis to create a picture out there. And We still have 15, 20 minutes. I would like you guys to ask questions and we can have discussion rather than I keep speaking for the next 30 minutes. Go ahead.
Saying that you don't feel good enough. You don't feel
You can stand up so that everyone can listen.
So sometimes it's hard to be a Muslim, saying that we hold everything to certain standards. We hold ourselves to certain standards, and then we don't meet those Muslim standards, so to speak. And that creates depression. For example, if I don't know, Mr. Sarah, for example, that's a big problem. That will haunt me for 2 to 3 days, maybe or more. Maybe there are other things in life, which I didn't achieve that Islamically, and that's a cause of depression.
Now, this is a great question. This is a day-to-day struggle, right? 2 days ago, I woke up at 7 o'clock and the Salah ends at 7:07. So I had 7 minutes. I ran to the bathroom, do the wudu. By the time I came, it was 7:05. I said, let me just get the first Salah there. But by the time I said Salam, it was already 7:07, and you know the fiqh ruling, if you're doing the first Salah for the Fajr, and if it enters the time, you have to repeat it. Now, technically speaking, I have missed the Salah and I have to do Qada. Spiritually speaking and religious knowledge, I was sad. You have to be sad, right? Because it's a huge thing. But let me tell you one principle, if it can help you. Is life a 100-meter or marathon? End of story. You have to think about life as a marathon. So if you fall today, you want to run tomorrow. Do not get stuck with that fall. Because what brain does, it would get you back again and again to that fall. And does not let you get out of that fall emotionally. And that's what creates what? The rumination, the depressive rumination, which is again going back again and again. Let's take any other example. A loss. For example, you had a car accident which was your fault, not someone else's fault. An unhealthy mind or unhealthy way would be just get stuck with this, oh, if I would have just pushed the brakes in time. And then you create scenarios. Why? Because hindsight is what? 2020. You can fix everything in hindsight. Just literally everything of your life, you can say, I can fix this, I can fix this, I would not have made that mistake. If I would not have made that mistake, if you would not have made all of those mistakes, you would be an angel, but you're not an angel. Life has been meant to be this way so that you make mistakes and learn and keep going on. And Muhammad knows that hadith, I don't know the reference, I don't want to misquote it, but I will quote unquote, is a hadith Qudsi, like I'm just paraphrasing, that if everyone starts obeying Allah, then Allah is going to wipe out all those people and would create those people who would make mistakes and do tawbah. So every single moment has its role, but on day-to-day basis, if you start getting stuck in those kind of situations, you reframe your thinking. That I have to make my tomorrow better. Because what has gone, you cannot do anything about it. I'm a professional psychiatrist, but I do this on daily basis. Saw a patient yesterday, then you think about it, oh, I should have made a better clinical judgment. You understand? This is day-to-day human struggle. You had an argument with your husband. Now, I know you would not accept it on his face that you said something wrong, but at least when you're on your own, you know what you have said. And then you can get stuck with that. Right? So if you get stuck with that, what needs to happen for the much healthier brain, that you accept that problem and then you share that problem. But most of our marital relationships are not like that. They're not open communication relationships on both parts. But at least on one healthier level, you should be able to acknowledge your made mistake and self-reflection. Go ahead. I think you were the... Yeah. Top 3 what? Root causes? We don't know. No. There's no. No, there is none. We don't even know how depression happens. For 40 years. For 30 years, we had the theory of serotonin, neurotransmitter. For 30 years, we sold those medications. And now, since the beginning of last decade, it has shifted to NMDA. Now, you might have heard the ketamine clinics and all this. Every decade, there's a new theory out there to understand what is depression. We know anecdotally, for example, the medications I give, it works for 70% of the people. I know that. Every single day I have patients who come to me who are literally struggling, PhD students, Harvard students, top students, doctors, struggling every day with anxiety and depression. You put them on the medication, and after 2 months, their life is different. Based on that, serotonin theory seems fine, but then there is a huge percentage who do not respond to these medications. Now they have started working on a new neurotransmitter, and ketamine is working. But the problem with that is it's short-lived right now. It's not a long-term solution. It's addictive. It has other problems. You want to say something? Right. Right. Right.
And also the fact of what's your tolerance limit to a certain level, right?
Absolutely. Absolutely.
The threshold.
Absolutely.
How the biochemistry will react to the environment and how you perceive a certain challenge.
Absolutely. I think he mentioned it very nicely. I assume he is a physician. Okay, no, but it's very, very, very nicely, right? Like, I didn't want to make it more complex, but let's say, make it more complex. The way we understand, at least where we try to understand, we all have genetic component, right? Which we took it from our parents and family. Now, if your grandfather had schizophrenia, you're already vulnerable. It's somewhere in there. Okay, it's there. Now it really depends at the age of 18 to 20 it gets activated or not. For many it does not. Even they have that gene in them, but a young man goes to Harvard for PhD, stressor goes up and up and up, he's not able to handle, and the brain snaps. The gene gets activated, he gets his first psychotic episode, he goes to hospital, they treat him, he comes out, he thinks, it was because I did not sleep well. What he does not realize that something has got activated. The same way depression. There is phenomena of reactive depression. For example, I was a healthy young guy, function and everything. I ended up having a divorce, right? I ended up having a divorce. I lost the custody of my kids. My wife and kids have left, and I've started getting into depression. And this is my first ever episode. I go to the doctor, get treatment for 2 years, stop the medication, my life goes back, and never get any problem again. That's one kind of phenomenon out there. The other kind of people, I just saw someone this morning, 32, The only thing he remembers, even as kid, as 6-year-old, that he was always depressed. He said, even as a kid, I was never happy. And I was never able to explain. I was quite shy in the world of my own. But as I keep growing up, those episodes started becoming stronger. I was teenager, I started having suicidal thoughts, and that was the first time I told my parents about it. And since then, I have been in and out of treatment. Sometimes it gets better. I do well. Sometimes it does not. I took a medication which kept me stable for 5 years, and I was happy about it, that my life is functional. But now I've started feeling like it's not working anymore. Similarly, anxiety. I just saw someone comes from a very, very highly functional, intelligent family, and she is herself very functional, and she said, I've always been anxious. Just always been anxious. I said, okay, was there any genetic stuff out there? Yes, my mother was anxious. She never got treated. But generally, my life was okay, and my childhood was okay. So why I'm stressing about this, that sometimes we can find some apparent correlations, right? Somebody got divorced, makes sense. He lost everything and all that stuff. Somebody had a test, an exam, and it made him or her super anxious. Or somebody had a really bad day at work. A few days ago, a friend of mine basically said he took treatment for something and he became anxious. What should he do? I said, okay, tell me all the symptoms and everything. Now, because I know him for a while, so I know his baseline. I said, okay, tell me the symptoms. And this is how we are going to manage it. So he was open to the idea, whatever medication or whatever I had to suggest. He took care of it, and after 7 days, he's fine. So again, situations. One of the key things is the only take-home message which you can take today is, do not just have a blanket understanding of everything. You understand my point? If someone comes to you, take them, the best help you can do to them, especially within our community, help them to take them to a professional. This is the biggest help you can do. It is quite possible they go to a professional and the professional assesses them, evaluates them, and end up telling them, okay, it's nothing much. Don't worry about it. Or someone can say, okay, it's something serious, you need to take care of it. Do you think every single person who comes to me and I ask advice, I said, okay, get on the medication? No. You assess. Sometimes I say, okay, fine, seems like gray area. Let's monitor for next 3 months. If you get better, fine, don't come back to me. But if you start declining more, we need to do something about it. Go ahead. I'm sorry? Tips to improve our mental health? Okay, that's a good question. What are the tips to improve our mental health? I've been working on it myself also, because it's a huge question right now. I would suggest, especially for your age group, because your vulnerability is far more higher than my vulnerability. Okay, because your social pressures are far more than my social pressure, or their social pressure, or their social pressure. Every age group has its own stressors and social pressure. With regards to you guys, I would just suggest 3 things. Have healthy group of friends. Social media is a necessity for your age group. I understand it's a necessity for everyone now these days. I'm not going to give you unrealistic expectation, just stop everything and all that stuff. but really think about what you need to consume. Decide for yourself. Just don't be a empty consumer. Do not listen to every single news out there. You really don't need to know, if unfortunate, it may sound harsh, but you really don't need to know every single day what's happening in war zone. You don't need to. You know why? Because we have circle of influence and circle of control. The only circle of control in your life is your own self. The other problem which has happening since post-pandemic or even before that, we are just consuming so much negative information all the time. This is happening, this is happening, this is happening, this is happening. People know about everything else, but they don't know about their own selves. So that's two. And number three is try to become more and more self-reflective. For example, you had an argument with your mother. She said something, you said something. She became reactive, you became reactive. The argument got heated. You stormed out of the room, you went to your own room. Now there are two ways to do this. The typical human brain is going to do what? You are going to become angry and you are going to say, who is at fault? Right? Your mom, not you. This is a typical human brain. The same happens in every argument out there. But that's where what you have to try to start learning the skill that you back off. From where did this argument even start? That would start helping you to become more reflective of how you think. You know, when we were talking about earlier, like if an incident happens, it really depends how you think about that incident. Because someone cannot be clinically depressed. They do not need to be clinically depressed, but they can have a depressive thought process. Have you ever seen those people? You sit with them, it seems like there is always something negative going on out there. Why? Because they have become so used to think in a negative manner. For anything, whatever may happen, they would have a negative conclusion to the story. Make sense? So these are simple things. And secondly, you are young, you should exercise. Even recently, last week, they had said the physical activity, exercise really helps mild nature of depression or anxiety. It helps. We have become more and more inactive because we are more stuck with chairs, laptops, cell phones.
You see that kind of like disease or depression and anxiety. Do you see it like more in the poor societies or rich societies? The reason why I'm saying this, in Africa, for example, some parts of Africa, you have good clothes to put on, at the same time you're happy. Is that sign that they're not depressed, they don't have that type of issue? That they're fancy and happy every day, just
I think this is a really good question, but I think the basic difference in phenomena is the amount of information gathering. How much information you know about Africa on daily basis? It's good, right? So, but on daily basis, it really depends. And then the secondly is the diagnosis. I always used to have the same assumption about Pakistani society. People always seemed happy. But now when I start seeing things as a clinical psychiatrist, I could easily see the difference between a healthy person and a non-healthy person. Now, because I do not know the exact stats, how it is in those countries and how it is in the United States, I would not like to make any blanket statement about it. But just on clinical level, in general, lifestyle here is a bit more stressful. Because people have, I think, a lot more resources, and the attachment to those resources is very different to someone who has never seen full plate of food. So then he never learned the lesson of how to even lose something or not, which he never had. Then how the lifestyle is lived here. So I think the comparison would not be appropriate because the paradigm is very different. Because if their source of strength is coming from family, religion, or other stuff, then they would rationalize their loss within that paradigm. For example, I often say within my family, one of the simpler sentences, which I think Pakistani Urdu speaking can easily understand, कि जो चाहे अल्लाह चाहे, right? Allah ने चाहा और हो गया, like Allah wanted it and it happened. Just this simple sentence sometimes takes away the burden of the biggest problems in your life, right? What are you exactly doing from clinical perspective? You're just displacing the reality from your hands to whom? Don't take it as a blasphemy, but to basically an abstract idea. I know as a Muslim, he exists and that's, but just looking from a clinical perspective, what you're doing is, my problem? No, not my problem. His problem. So what it does, at least it reduces the acute stress. But because of our faith, we know that's the reality. What I am doing is not just thing, it's actually the reality. He is the one who decides how much of a difficulty I'm going to have and all this stuff. So every society has a paradigm. The society where you are living, as I said, you and I can have a very different vulnerability to all this. But that beautiful kid would have a very different vulnerability. Because he is growing up in this. The kids he is going to go with, the people he is going to interact with. So that becomes very essential, a different kind of discussion for a different time. I think I'm just. I think as I was telling her, all of these naturally engaging activities make a huge difference. We know sitting in front of the screen is a depressive factor. But again, I just want to make sure that you think clearly the difference between correlation and causation. You can have a kid who does not have genetic vulnerability and any of that stuff and can sit in front of screens for 10 hours a day and can be the happiest kid out there. And there can be a kid who has this genetic vulnerability and the risk factor goes into his life and can start acting depressed. It's a complex thing, right? That's what as the brother asked earlier, what are the causes? I said, I don't know, because we don't know. We know the risk factors. A single divorced male is a higher risk factor for depression or suicide. We know the risk factors, but it's not causation. If this is going to happen, then this is going to happen. And most of the studies are also on those lines. For example, if I said physical activity would help, we know it does, but I have so many depressed patients who are just working out 5 times a day. The depression doesn't get better. But does it mean that they stop doing it? No, we ask them to keep doing your healthy stuff. Yep.
Talking about depression and how that might affect people, when don't you think there's nature and the nurture, two components play a role? The percentage is for weight, like you said, weight is for weight.
Right.
But the reality of it, sometimes when you look at society, even within society, within family, is what is the value system? Right? And how real is the value? For example, you might say something, but if that's not acted upon, then there's almost a cognitive dissonance.
Right.
And sometimes, especially you talk about kids growing up, when they see that, the confusion also sometimes, again, even the vulnerability, they can flip this way or the other way. And I think it's a conglomeration of factors. Right? It's genetics, it's culture, it's also.
It's nuanced. It's nuanced. Look, let me just put it this way. Human life is nuanced. You can try to think it in a simpler manner, but that's not the case. Look at your own lives. Do you think the way you are today, you were 5 years ago? Tell me honestly. Or when you were 10 years ago? Do you think the way you are today, you were at the age of 5? Why there is change? Why? Because Allah has designed it this way that every decade of life is going to bring different kind of issues for you, and you are going to be in a different kind of framework to deal with them or not to deal with them. So it's a journey. As I said to this brother earlier, like it's a marathon. Sometimes we get short-sighted about this and now, and get stuck either with the good or bad. Go ahead. You have to speak loudly, please. So the COVID-19 effect. So I think it's very obvious that COVID-19 has literally skyrocketed the problem of depression and anxiety, especially within this society, especially the lockdowns. Because people did not end up realizing how much good, healthy socialization is a healthy factor for human health. And people just became struggling more and more, especially it also depends on the personalities, right? If someone who likes to be at home, they really did not notice much, but people who were more extroverted and wanted to go out, they really suffered badly. So it has impacted kids, it has impacted teenagers, it has impacted adults. And actually the amount of patients I saw within the last 2 years was way more than even before that. It has. Now, COVID-19, the virus itself, yes, that's another problem. There are many patients who got COVID-19 and ended up developing chronic anxiety and depression. It's another phenomena altogether. Go ahead. Last question. Go ahead.
Thank you so much for opening our eyes to this problem in our society. The question that I have is, what advice do you have for someone that actually able to recognize the problem? I feel anxious, I'm really depressed, but they are having a lot of issues to navigate the healthcare system.
Healthcare system, okay, I think it's a really good question, and I think it was a really nice question to sum it up. I would assume that all of you sitting in this room has a primary care. I would assume that. If you don't have, then you should have. Okay, this is how the system operates. Just because you're just doing okay, it does not mean that you should not have a primary care. That's bad. You should have a primary care. You should have a doctor where you can go to. That's number one way of, because many of the insurances would ask you to go there first, and that person sends you referral to either a therapist and all that stuff. That's a legal, logistical issue. The secondly is your primary care is your best choice, but if you have good health insurance, then find a therapist or go to a psych clinic, find online psychiatrist. It never hurts to just get an evaluation. You understand my point? Many people think like if you're going to go, the other person is going to give you medication. Okay, fine, they can give you the medication. If you don't want to take it, don't take it. but at least get yourself evaluated. At least let the professional see you from an unbiased eye, which your friend cannot do that, which your mother cannot do that, because anyone else would be trying to minimize it. No, 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 you had this because of this. Oh, no, 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 you had this because of this. So you don't need help. What's the way it happens within the family? So at least just get the evaluation. And if you feel convinced that you need more help, then you seek the help. One last thing, I know we have a huge issue. We don't have many Muslim therapists. We don't have any Muslim psychiatrists. And for many Muslim patients who come to me, it becomes a huge issue for them that we cannot trust. Look, here is a simple thing. Don't you guys go for your physical illnesses to a non-Muslim doctor? Don't you guys go? You go if you need to. The same way, there are professionals. I've studied with them, I have spent time with them. They are good professionals. A bad doctor can be a bad Muslim doctor. The bad doctor does not have any religion. You need to have a good doctor. That's the point. Now, one last thing. Can they understand the cultural nuances of the problem? For example, if the marital issue comes in or some social cultural issues, yes, that's a struggle. That's a struggle. Or if you would try to explain to them that I offer my salah 5 times a day, but I'm not having a spiritual happiness about it, and he cannot relate to it because that's not his paradigm of life. Even he may be an atheist. But a good professional would not bring it into that. He would say, okay, fine, like, I don't know much about your religion, but why it's not helping you? He would have a discussion with you. So never hesitate to see a good doctor. We have limited resources. We don't have much resources out there. So whatever resources you always make the best out of them. Jazakumullah khair for your time. I know I'm just giving some overview because it's a very complex topic in itself. I hope some little benefit came out of it. Jazakumullah.
Jazakumullah khairan, Marco, for coming. And as you can see, like, the interest is there, and I think that needs to be addressed from Islamic perspective as well. But alhamdulillah, inshallah, in the future we have more opportunities to do this again.